Around 1.5 million people in the UK are thought to have sleep apnea. In this week's video, I'm going to give you more information on this very serious condition, which is quite often missed. Okay, so before we learn more about sleep apnea, you might be thinking to yourself, why is it such a serious health condition? Well, research has shown that obstructive sleep apnea is associated with an increased risk of conditions that affect your heart and circulation. Now you're probably thinking to yourself, well, what does that mean? Well, it basically means an increased risk of coronary heart disease, increased risk of heart failure, increased risk of strokes, as well as high blood pressure and abnormal heartbeats. And also, please remember that sleep apnea isn't only associated with heart conditions, it can also lead to depression. Sleep apnea can also make you more prone to having accidents at work or even when driving. In fact, it's estimated that in the UK, up to 40,000 accidents happen per year on the road whilst people are driving, they're falling asleep due to sleep apnea. So as you can see, sleep apnea is very serious, but very few people are actually aware of it. So what is it? Well, in short, when we sleep, our upper airway relaxes. Now in obstructive sleep apnea, what happens is those upper airways either narrow or they collapse. So when this happens, it can stop you from breathing for about 10 seconds or more, and then your brain realizes and it wakes you up, and you feel like you're choking, gasping or out of breath. You then quickly regain your breath and you'll fall back to sleep again, and you usually won't remember any of it, unless someone else is with you and then they tell you about it the next day. Now the bad news, this cycle can continuously repeat during the night, and it can sometimes happen over 100 times per night, and it's going to affect your sleep pattern, and you might not even realize that it's happened all night. So because of this, you're not going to get proper sleep. So you're going to feel tired all day, you're going to struggle to concentrate, and you might even be dozing off during the day. So what are the other symptoms that you need to look out for? Well, there's snoring, making choking noises when you're sleeping, having a dry mouth when you wake up, having a headache when you wake up, and also having mood swings throughout the day. Now, if you do have any of these main symptoms, you need to speak to your healthcare professional, because you now know how serious sleep apnea can be. But also, don't worry, if you do get diagnosed with sleep apnea, there are many treatment options available out there. Also, if you have forgotten the list of all the symptoms, I will leave it in the description below for you, so feel free to read it at the end of the video. Which leads me on to my next question. Who's most at risk of developing sleep apnea? Well, sleep apnea can happen at any age, but generally speaking, men aged between 30 and 60 are at an increased risk of developing it. There are also other things that can increase your risk of developing obstructive sleep apnea, and I'm going to speak about them on the next scene. So what puts you at higher risk? Well, a few questions. Are you overweight? Do you have a large neck circumference, so anything more than 43 centimeters? Do you smoke? Do you drink a lot of alcohol, especially in the evenings? Do you drink alcohol? Also, do you have any relatives, close relatives, that suffer from sleep apnea? And there are other risk factors as well, so if you're using sedatives to go to sleep, if you're sleeping on your back, and if you have certain medical conditions, these can all increase your risks of getting sleep apnea. Now, I will leave a full list in the description below for you as well, that you can check out at the end of the video. Now, if you do think you have sleep apnea, you need to speak to your healthcare professional, and we mentioned this earlier. But there are also self-care tips that you can do in addition to the treatment that your healthcare professional has started you on first. So for example, losing excessive weight if you are overweight, try to reduce your alcohol intake and don't drink any alcohol in the evening. Try to quit smoking. If you use sedatives to sleep, then try to avoid using them. And also, if you're used to sleeping on your back, try and sleep on your side. Now, if you have been to your healthcare professional and have ruled out sleep apnea and you're just a snorer, well, the good news is I made a video not long ago about useful exercises that you can do that can help reduce your snoring, and I will leave a link up here and in the description below. Definitely check it out, it's got some really useful tips on it. Thank you for watching this week's video. Sleep apnea is definitely a topic that we need to spread more awareness on, and I really hope this video helps to do that. You now know what to look out for, you now know what to do, and help spread the word. Tell your friends, tell your family, tell your loved ones, tell everyone. Always remember that you're awesome, and I will see you next week. Well, research has shown that obstructive sleep apnea is associated, not associated, but associated. You then regain your breath, which leads me on to, I can't even say which. Today is a very bad day of filming. I feel like I'm off form today. Don't know why I'm off form. I feel like this shirt is too tight as well. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.